Hi, I'm Kiara Sellers, and I'll be doing my oral presentation for English 112 on reasons why I feel as though healthcare workers should have a mandatory policy to receive the flu vaccine each year. Before the winter months, campaigns roll out. Advertisements are everywhere. You'll see them in drugstore clinics, you'll see them in hospitals, you'll see them on TV, maybe even go across your computer screen about the flu and the flu risks. So being a hospital worker, you will have like the hospital organization you work for, they'll roll out the flu campaign through them, letting you know where they are hosting, where you can get your flu vaccination each year. I mean, they send out numerous of newsletters and letting you know like the risks of the flu. But even though with all this going on, like a lot of the employees, they still refuse to get vaccinated due to religious beliefs. And you also see like allergies. People with allergies refuse to get vaccinated. And I mean, you will see a lot of employees also refuse to get vaccinated because they feel as though they're healthy, but healthy people do get the flu also. I feel as though all healthcare workers should receive the flu vaccine. The CDC does recommend that all healthcare workers receive vaccination because it states that the best prevention of the flu is vaccination. The vaccination has been shown to have many benefits as far as respiratory illnesses, prevention of pneumonia, hospitalizations. You'll see the CDC also says that the flu vaccination prevents illnesses in young kids. It also recommends that kids 6 months of age should get the vaccination also. It is important to receive an annual vaccine because that is the way that it is given, is annually, because the new vaccines that are created yearly, they are created to prevent the rapidly adapting viruses within the flu. The flu vaccine is uncomfortable. It is life-threatening, which is like one of the major risks. And as a healthcare worker, you come in contact with like sick patients, and receiving the flu vaccine, it protects you, yourself, your patients, your staff, and your family. Emily DeYoung, in her article, she states as though how some healthcare workers that refuse the flu vaccine, they are terminated, or they have to wear like masks the whole entire shift, which can be very uncomfortable. Also, within like the year 2017 through 2018, that's the flu months, they were reported that 80,000 flu-related deaths and 900,000 flu-related hospitalizations, which had been like an increase within that previous year before 2017 to 2018. 2017 through 2018 also set record for a high of deaths, flu-related, and hospitalizations also. Although a great number of citizens, they do refuse to get vaccinated, and hospital workers included, I feel as though it should be considered, to take the flu vaccine, because although patients have rights, us as workers, hospital workers, they have rights. So, but I do feel like it should be considered to be a mandatory policy because the major risks, and having that vaccine at such a small cost to little to nothing is like, it prevents so many things. It prevents, you can save a life, you can save your life. You just never know. So I feel as though that healthcare organizations should take in consideration to mandatory vaccines for its staff. It protects everyone. Thank you.